Hello, everyone. Welcome back to the Ground and Root podcast. I'm your host and holistic cancer dietitian, Dion Detraz. I am really excited. We have a special guest with us today. One of my former colleagues. We were just talking about how it's been like almost 10 years now since we were working together, but we used to be office mates at the UCSF Osher Center for Integrative Medicine. We have Tracy Peng with us today. She is an integrative psychiatrist who is transitioning now into private practice in the San Francisco Bay Area. And she does incredible work in the field of integrative medicine and psychiatry, as well as supporting women who are moving through a cancer journey. So she has so much knowledge to share with us today. We are going to dive into a little bit, I'm going to give you high level and then we'll let Tracy get going. So for this month, and if you listened to last week's episode, then you already know this. For this month, we are really looking at stress as a driver of cancer and disease in general, and what to do about it, and the different causes of stress. And one of the things we talked about in last week's episode was just how certain events in our life, right? Certain emotionally charged events, whether that's happening in childhood or in our adult time, can leave wounds, can leave trauma in our body that is creating this long-term chronic stress, and how we can help enhance our healing, help enhance our recovery by really infusing this as part of our healing plan, right? Instead of just treatment, just food, all these things that are really important, we still have to look at the emotional components as well. And Tracy is definitely an expert in this area. So without further ado, thank you so much, Tracy, for being here with us today. It's so good to have you.
Oh, thank you so much for having me. It's such a joy to see you again.
No, for me too. For me too. It's
Yeah,
been too long. It's been too long.
yeah.
I'm glad the podcast was a reason that I could bring us back together like this.
Yeah. Back
Okay,
together.
I know. Okay, so Tracy, tell us a little bit more just about you, your experience, the work that you do. Give us more info.
Yeah, so I started meditating right before I started medical school, basically to help with my own healing and my own suffering in my life. And partway through residency in psychiatry, I had a very dear visionary mentor who died of a brain tumor, a malignant brain tumor. And it just really tilted my worldview and my experience. And then I ended up training with Zen Hospice Project in a program called the End of Life Care Practitioner Program that was run by Frank Ostaseski and Angie Stevens, and had just very luminary faculty like Rachel Naomi Remen and Ram Dass and Francis Vaughn, Angeles Arian. And so I really started learning from people who had really integrated their spiritual lives with their practice in healing others, and it was really inspirational for me. So I really started with my focus on hospice and end of life, which is the opposite from how people with cancer experience it. They start with a diagnosis, and then that's something that may happen later on, or maybe not from that particular cancer. Yeah, so I just was immediately immersed in the very kind of ultimate aspect of psychiatric care in terms of like death and transformation. So really that's what I've been doing as an integrative and holistic depth psychiatrist in San Francisco, is really facilitating a lot of personal transformation in the patients and focusing on state of mind for people who are not necessarily looking for deep transformation. And so I see a variety of patients. I do see quite a few cancer patients, but also a lot of people who don't have cancer. And it's just really opened up, I feel like, what the modalities are that can be useful. And there's so much there that people can gravitate towards and plug into as resources along their journeys. I think the people can be surprised working with a psychiatrist when they have a medical illness, that having a psychiatrist as their main mental health care support, somebody who has medical training and has been to medical school, can be very comforting, I think, for people.
Mm-hmm.
And I think often they don't realize that coming in, that psychiatrists are the only mental health clinicians that go to medical school and have that kind of medical training. That's just
Mm-hmm.
a part of the foundation. But it comes in really handy. It comes in
Yeah.
really handy. So I've had people come in that are in their cancer journeys where I've never seen a psychiatrist before you. I never needed a psychiatrist before, but they get it, like how useful it is, those skills and that experience that psychiatrists tend to have.
So I'm curious, Tracy, like how does somebody even know to get in touch with you? Is it something that's brought up with their doctors as a referral? Like this might be really helpful, or is it somehow in the journey they realize that they need some extra mental health support because the cancer experience itself is so difficult and challenging? I'm just curious like, what is the path, right? Like, how do people get
Yeah.
in front of you?
Yeah, there are many paths, but those are
Yeah.
two that are very common is an oncologist or a primary care physician will just notice this patient is really anxious or they're stuck in some way, or sometimes people are depressed. And so they will make the referral. Definitely that's one pathway. Sometimes I had a patient recently who was like, my daughter is a physician and my other daughter is a therapist, and they looked you up.
That's awesome.
You
Yeah.
are the one that that my daughters think I should see. So
Mhm.
it really runs the gamut in terms of what gets people to feel like, oh, this is the right step for me right now. But
Mhm.
it's usually some discomfort of some kind spurring people forward. Yeah.
Yeah, they'll know that makes sense. Because I feel like too, this is something I've seen in the people that I work with where sometimes they're coming into the cancer journey already with like traumas and stressors from their past, and sometimes not, right? So the people who are coming with this history may have already worked with mental health providers, and that feels a little bit more familiar. And of course, we would just continue that journey through this healing experience too. Whereas others, if they haven't had that history, it might not be on their radar, which is another reason why I really wanted to bring you on, because I feel like when you're advocating for your healing journey, like a big part of it is pulling together a team that is going to support you through it. Right.
Yeah.
And sometimes we forget the mental health component that is equally important.
Yes, yes. And I think the mental health component is very natural because if you think about how
Mhm.
people are feeling when they first get diagnosed, it's
Yeah.
very stressful. It's very anxiety provoking, or when they're getting their biopsy results or cancer marker blood test results or scan results. There's just a natural anxiety that is just so often a part of the journey
Hmm.
that I think it's really just foundational to a care team for most people if they think of it.
Yeah.
And also, I think there was a study done a long time ago that was looking at breast cancer, like breast biopsies, and they had divided them into people who felt like they had emotional support or someone
Mm.
to trumpet on, and people who didn't feel like they had anyone to talk to. And it was like the biopsy results from the people that felt they had a confidant were way more often negative for cancer than the ones who felt like they had no one to talk to. And so there's just really so much
Yeah.
just emotional support that is needed and
Right.
just so obvious. Obvious.
Yeah.
Mhm.
Isn't that crazy? Yeah, for people to, particularly if you've never heard that information before, that can be mind blowing.
Right.
And that is really why I wanted to spend a whole month talking about just emotions and stress
Um,
and nervous system, because I think we're really undervaluing how much this can enhance your experience. Everything from physiology enhancing your immune system and all of this, but then also just to your resilience and like emotional wellness as you go through, which could very well be one of the most challenging things you've ever done in your life. Okay, so people are coming to you. So guide us a little bit around what you've seen, like your experience around the importance of not just for biopsy results, which could be very helpful, right? But also just like supporting emotional health, supporting going deeper, supporting
yeah,
mental health. What has
yeah,
been your experience in seeing like how does that actually benefit someone as they move
yeah.
through a journey?
Sometimes there are these dramatic stories. Like I had someone come in 2 or 3 years ago with breast cancer and had a non-healing wound that kept having a wound dehiscence where it kept opening up, and it was getting hyperbaric oxygen and all the state-of-the-art treatments. And as I talked to her, it was so interesting because there was this buried trauma from about a dozen years prior where her kind of teenage son had died as a result of a hazing incident. And then her
Mm.
whole community had turned against them because they didn't want their own kids to have to face consequences of behavior that had resulted in their peer dying.
Wow.
And it was like so symbolic of a buried wound that wasn't healing because
Mm.
it didn't receive kind of attention, and the kind of healing ointment of just being able to tell the truth and having the people around you be okay with the truth being spoken.
Yeah.
And just after working with me for a couple months, I think it healed. I was just like, wow, these very symbolic things can have very real medical outcomes that I
Hmm.
think we underestimate walking through life. Because
Yeah.
then we tend to focus on the biological, like the genes or the diet or the chemo,
Hmm.
or that we're all so focused on the physical and the biological on that level that I think sometimes we miss the big picture of what
Yeah.
is going on in the life of, in the journey of the soul that's making their way through this incarnation.
Yeah. Yeah. That's
What's
beautiful.
buried, what's hidden, what's not receiving attention that has needed attention for a long time.
Yeah. And cancer is sometimes that permission slip to
Mm-hmm.
actually go to those places that we don't want to, or we've been
Yeah,
avoiding, or, but it's,
that hasn't been safe to, or hasn't felt like
yeah,
you have resourcing to with
right.
that.
And this is where having a professional to guide you through that is going to be probably necessary, if not just really helpful
Yeah.
to process some of those really difficult emotions.
Yeah. And I think you probably remember working next door to me, Dion, that it is true that there's heavy content and there's heavy things that come up that people do explore and free up the energy that's stagnant around
Hmm.
it just by being willing to face it. But there is a significant amount of laughter that comes out of my office every day. And people have commented to me, like, I did not think a psychiatrist would have loud laughter coming out of
Yeah.
their office. So it's a freeing up of energy that's tied
Yeah.
up in things. It's not to make you feel like you're identified with this the most horrible thing that ever happened to you. It's not about being like, oh, now I'm damaged and I'm a victim and I knew it. It's not that. It's freeing up the energy, allowing that to open up and heal, like an abscess, I would think, on
Mm.
a level, like it does need to be opened up and drained so that it can heal, but the process can be smelly and messy, and
Yeah.
it's just part of, but it's part of the journey, but it can really help things to finally start to heal on a fundamental way.
I mean, and laughter can be a really good way to move energy too, right? It
Yeah.
doesn't always have to be tears. It
Yeah.
can sometimes be laughter that
Yes.
can, yeah, I love that.
Absolutely, because life is funny. We have
Yeah.
these bodies, they're very awkward. There's like it's just like when you go through cancer treatment, like, ah.
Right. Right. No, it's so true. It's such a good perspective. Okay, I'm curious because one of the things I touched on in the last episode I shared was around some of the research around emotions in cancer and
Uh-huh.
how we're seeing some like correlations or kind of predictability around, particularly around not how do I want to say that? Suppressed emotions, like unresolved, right? Like where I'm not expressing my anger, I'm not expressing my resentment or my grief, just sort of like the bearing versus the letting it out and really saying how I feel about something. I'm curious. So, in your practice, in your experience, is that also what you're seeing? Or what are some of the things that you're seeing that are coming up that seem to be underlying or some correlations?
Yeah, I mean, there is all of that information on, I think it tends to be more breast cancer, like it just around people pleasing and not speaking about negative emotions or putting a happy face on things when and burying a lot. And especially if people come from contexts where being honest and open about how you feel about something is really not welcomed.
Hmm.
That could have been a very adaptive survival strategy for earlier periods in life and maybe still necessary. But the body keeps the score. The body does not, I believe it kind of lodges in your cells,
Yeah.
hangs out there and accumulates. And so you may be keeping the peace on the day-to-day level by not speaking to your experience. There is a silent
Hmm.
cost, is my sense. And then some people do decide to start setting different boundaries and to
Hmm.
start speaking up more when they feel emotionally unsafe with people in their lives, or not inviting certain people to things that where especially if the person being invited makes them feel unsafe. emotionally. People start making different decisions, and sometimes the people around them initially are not super happy with it
Yeah.
because they're used to you being a certain way or being yielding in certain ways. And all of a sudden, you're checking in with yourself like, does this work for me? Maybe for the first time. And
Mm-hmm.
no, you're saying that's not going to work for me, maybe for the first time. And so there's an adjustment, I think, for everyone in that kind of growth process of just retraining the people around you to respect you more and your space and your emotions.
Yeah.
Because sometimes the anger is really appropriate, that like a boundary
Right.
has been crossed, there's been disrespect expressed. Or I had a patient that we were talking like this on Zoom, and she was in the office, and all of a sudden halfway through our session her husband comes in, I have a printout, and just basically like kicks her out of the office. There's just no sense of, she's having a private session right now, a printout can wait 20 minutes.
Mm-hmm.
There was just no respect. It was clearly like a default kind of way of relating,
Yeah.
and it was very helpful for me to see this is the dynamic at home.
Yeah.
And she started speaking up, and it's been, this partner is not abusive. She's had others that have been, where speaking up in that way could have been physically unsafe.
Mm-hmm.
But in this situation, it was more an uncomfortable transition, but a very positive, healthy reset that allowed both of them to grow.
Yeah.
But you also have to think about your situation, because if you're in a partnership where someone could get physically violent with you because you set a boundary, that's that
Mm-hmm.
cost too.
Mm-hmm. Yeah.
Yeah.
And what I know, this is something too that we've talked about separately, and I mentioned it a little bit on the episode last week, but some of the ways we've learned to cope or manage our stress response, like to stressors in our life, is happens in very early childhood,
Yeah.
right? And so that also, what our childhood experience could very well be affecting us now, and just like how we react to things, right? Do you see this too?
Oh, yes. Yeah, definitely. Yeah. And maybe less so for people who have been in effective psychotherapy in the past. That's changeable. That's mutable. We can grow and learn at any time. And I have people in their 80s, some of my Medicare patients that are like, I've never told anyone this, but I hated my mom. And but it's like that growth is happening late in
Yeah.
life, and it can happen anytime. So yeah, I do think that the coping, often it does get set in motion in childhood. And then if we don't get help to retrain it or to change it or to shift the trajectory, it can just be the default.
Yeah.
Yeah.
And I know you've shared with me too before, even just research around negative adverse childhood events
Mhm.
happening
Mhm.
and then actually increasing our risk for cancer later in life.
Yeah, almost double, almost double. So if there's a adverse childhood experiences screening tool, scores it on a scale of 0 to 10, and
Hmm.
it questions about parental divorce and childhood, different types of abuse, like emotional, physical, sexual abuse, losing a parent to mental illness, that those kinds of questions, where if you have four or more of them, then your risk of cancer, developing cancer later in life, is almost double. So 1.9 times the
Wow.
risk. So it's baked into, and also many other illnesses, both mental
Hmm.
illnesses and substance abuse, and physical illnesses like autoimmune illness as well.
Hmm.
So
Do you have some theories as to why you think that?
yeah, the main theory is about being in fight or flight or freeze, but basically having norepinephrine, epinephrine, and cortisol baths in your
Hmm.
body repeatedly throughout childhood, and having it be almost a repetitive default feeling of being unsafe.
Okay.
Yeah.
Well, it is encouraging to hear, because I can imagine if you're listening to this right now and you're like, and you're identifying yourself in what Tracy's saying, that could create some anxiety too, because you feel like,
Fair point. Fair point.
yeah, you're like, what do I do? My childhood was 40 years ago or whatever. And so
Yeah.
the fact that you just said that that is all mutable, like it can all be addressed even
Uh-huh.
later in life, I think is really encouraging, right? That's saying like it's worth looking at because it's not
Yeah.
set in stone.
Oh, absolutely. And I have a patient in her 80s who told me We were just doing some work on her feelings of rejection and being left out, and just a lot of grief under there from childhood and like first marriage. And so she just was open and felt a lot and kind of cried a lot. And then like months later, she's like, when I didn't get invited to this thing that would have triggered me in the past, I felt nothing. I did not feel triggered or left out or excluded, because my sense is that she'd finally accessed the inner child parts of herself that felt so excluded and left out or rejected as a child, and really brought them into her own sense of, I love you. I love
Yeah.
you, even if you weren't loved then. And then it doesn't get triggered so much later on.
Yeah. Right.
Yeah.
It kind of like back to your original example too of just allowing the wound to heal. And
Mhm.
then once it's healed, like we can move forward. It doesn't mean it's going to continually be reopened.
Yeah.
Right.
Yeah. And that's the whole point. I mean, I'm a very outlier type of psychiatrist. Like the business model of psychiatry is 15-minute med checks to check on your antidepressant. And that is a useful tool. That's not the paradigm that I'm working from, obviously. But it can be really helpful to just open things up just enough. And then my whole care philosophy is about helping people connect with their own inner wisdom, because it's really often
Mm.
right there. It's right there. It's got all this stuff in the way that might have to do with childhood trauma or traumas that you've been through as an adult, or just the culture of not non-truth telling in public life that we're seeing. If you can move things out, like people just have their own inner wisdom. And that is like the most efficient therapist. It's great if I know things and can share things, but somebody this week was like tuning in with her own wise mind, and the advice that she had for herself was just so spot on and better than anything I could have generated. And just the fact that she could connect with that inner wisdom, I think, is very empowering and should be empowering. It shouldn't be like, oh, Dr. Peng is the expert and I don't know anything. That's not what I'm working from. Like, I don't think most people need to be quote unquote fixed, but sometimes there's a reconnection with your own inner wisdom that can be extremely helpful. Yeah.
I love that so much, Tracy. That's why I love you and your work so much, because we resonate on that level. I feel like I'm constantly encouraging people to just check in on what feels true for them.
Yeah.
Because particularly in the world of nutrition or supplements, it's like you're inundated with so many options and conflicting things. And should I do this? Should I do that? And sometimes it's just exactly like what you said. Is let's just take a minute to check in with your own inner wisdom. Like what feels right to you? Let's start there.
Yeah.
I love that. I love that you're doing that. So
So,
good.
yeah.
So
It's so
good.
much easier too. There's so much less
Sure.
pressure on me.
Right. It's empowering for the patient and it's less pressure on the provider. Win-win. I
Crystal ball.
love that. Okay, so let's say we've gone to the heart of some of the wounds, let's say, or some of the trauma, some of the blockages have surfaced,
Yeah.
and we're open them up, clear them
Mhm.
away. What
Mhm.
are some of your tools? What are some of your favorite tools for helping people do that?
Yeah. The foundational one is an accurate narrative of what
Mm,
happened, because especially if you're talking about childhood trauma, little kids, when they're on overwhelm and they're in fight or flight and they're bathed in cortisol and stress hormones, they don't lay down narrative memory or explicit memory. It's usually all implicit memory, just like impressions and sensations, maybe smells or sounds. And so for those folks, it's just, what happened to me? What happened to me? Because often those people will come in and initially might say that they had a happy childhood. You just dig a little bit, you're like, well, that doesn't sound so happy.
mhm.
And so for that, accurate narrative is the first thing. A lot of people really benefit from mind body practices like mindfulness meditation, yoga, qigong, like things that really connect you to your own sense of fundamental well-being, which is really a human birthright, I think. But if you've ever been to a yoga class and just lying in shavasana at the end and felt that sense of sort of peace, that the practices that kind of lead you into that territory can be extremely helpful. And yeah, and then some people really benefit from hands-on body work,
Mm.
like craniosacral therapy or different massage, different types of hands-on work. I tend to I like working with the acupuncture meridians in emotional freedom technique. I really like these fear points here on the acupuncture meridians. But you might actually want to see an acupuncturist or an Ayurveda practitioner. Yeah, many tools. Nutrition, just healthy whole foods can be
Hmm.
extremely helpful if people are crashed out on soda.
Yeah.
My personal favorite, ice cream.
Yeah. Well, right. Like blood sugar dysregulation is going
Yeah,
to directly impact your mood
yeah,
and like capacity to do
yeah.
this work, right?
Yeah. Yeah. And if you're hypoglycemic, you're going to feel anxious and kind of
For
jittery.
sure.
So,
Yeah.
smoothing those things out. Yeah. The main thing is the willingness. And obviously you're going to need an oncologist if you have cancer.
Yeah.
But I have one patient that's thinking about not wanting to do Western treatment or wanting to reduce the Western treatment doses. And that's really taboo out there, and most oncologists I think are really nervous about that, and I think it might be because of not having other tools to offer.
Hmm.
If what you have to offer is chemo and
Hmm.
radiation and surgery, then when somebody goes, this is taking a toll on me that I can feel, it's hard to just be like, well, then you might die earlier,
Yeah.
maybe. I don't know. Do you watch the telepathy tapes? There were some
No. What's
episodes.
this?
Yeah, so it was like a research psychiatrist, I think, who used to be at Johns Hopkins, but now is, I think, in San Diego or maybe Portland. And she started she started researching nonverbal autistic kids and the telepathy between them and their parents, their caregivers. And it just branched out into all sorts of woo. And she's such a research oriented person that she really
Hmm.
wants to study, is it what's happening? Do you know what is this?
Yeah.
And so there was some episodes recently that were on energy healing, thinking about cancer cells as being cells that kind of are like narcissistic, or like the billionaires in society. They're like hoarding the resources, like the blood flow, like the blood supply, and like having a
Uh-huh.
bad impact on themselves and everyone else and the whole organism. And they were talking about it as a lack of coherence. And so
Mm.
they were more talking about it as, could it be affected by energy healing, where you're sending a coherent field to those cells of like, get back in balance with the
Right.
rest of the organism, as opposed to
Right.
this
Reharmonize almost, right? Yeah.
battle kind of imagery that a lot
Right.
of guided imagery people use about like sharks or
Right. Like gobbling up the cells.
killing
Yeah.
the cancer
Hmm.
cells and things like that.
Hmm.
She was talking more about like marinating it through energy healing in a coherent field that kind of gets all the cells actually more back in balance and on the same, realizing that they're all on the same team. And
I
instead of
love
having
that.
some hogging the blood supply and over dividing, and then others like
Right.
starved out of existence. Yeah.
Actually, I really love that visualization because particularly if we go back to the basics of cancer cells are our cells. It's not like a virus or something that came in and is
Yeah.
foreign to our body. It's like a healthy cell that went rogue, more or
Uh-huh.
less. So can we reharmonize it back to a healthy
Yeah.
homeostasis? That's
Yeah.
beautiful. Is she still doing the research or like where is she on this project? I want
Well,
to know more.
yeah, it's a podcast. You can just look on YouTube.
Okay.
Yeah, it's a podcast. Just look up.
Telepathy tapes. Is that
Yeah.
what you said? Okay.
Yeah.
We'll make sure it's in the show notes. We'll link to it,
Okay.
people, so you can
Okay.
listen.
I haven't listened to all of them, but the
Yeah,
energy ones, I was like, this is really
it's
interesting,
fascinating.
groundbreaking in terms of ideas of what illness is.
Right, right.
Yeah.
And it expands also, which is certainly one of my goals of this podcast, is to expand our understanding of the why, like the understanding of what's behind it, and
Yeah.
that there are these different layers and levels and right. And maybe energy and coherence is like a big piece to it.
Yeah.
Oh, I love that so much. Okay, we will definitely learn more about about this research. This is good. Now, in the very beginning, when you were introducing yourself and just like how you came into this work, you did mention your experience with meditation and mindfulness and how, like, from the beginning, that's been blended into this work for you. I'm assuming this also expands into spirituality, and I'm curious, like, what your take on that piece to the puzzle is.
Well, for me, that's foundational. For me, that's completely bedrock.
Yeah,
Without
like the bottom of the pyramid.
without that, I
Yeah.
don't really know what I'm doing. Yeah, things don't really make sense to me, but it's not like I talk about that with every patient. Do you know what I mean? But yeah, it's just like the biggest picture or like the deepest picture of what is going on in this incarnation. And what is my soul here to learn this lifetime is the question for myself and for everyone that I'm working with that I'm thinking about. What is the developmental learning here that this soul is trying to achieve?
Mhm.
And yeah, and I think there it also is, it's a force or a way of being that is so healthy and in harmony with the givens of life that, just like the acceptance of the fact that when you're born you automatically have earned a death, like it's just a part of how things work. And in Western culture, especially, there's just this denial of we want to celebrate the birth and then the death, we want to pretend like it's never going to happen, resist it. And so, actually, a lot of energy and fear gets stored over there that I think could be really helpful for that to be freed up and not to like focus on your death all the time, but freeing up the energy that's there that's resisting that fact of life can
Mhm.
really help us get that energy back and then be able to be more present because we have more of our energy here instead of locked up and resisting something that's inevitable. So that's
Yeah.
part of the spirituality. And then for me, what I've noticed with the people that my spiritual teachers and organizations that I've been a part of that have been helpful and wholesome for me is that there's a lack of materialism. Like they just understand that that the energetic of what's happening is the most important thing and the money is just a secondary priority. And something about that purity is makes them very trustworthy in a way that much of kind of our economic systems and the people that are grifting, you just know this isn't a trustworthy way of being. This is an extractive way of being where you're just trying to get from others or steal
Mhm.
profit off of their other people's labor, etc. So
Mhm.
at its best, obviously there's been lots of corruptions, even the Catholic Church with all of the molestation. There's a lot of caveats there, but at its best, spirituality and spiritual practice is just a tremendous resource for being with life as it is. Yeah.
Yeah. Is that something that I mean, I know you mentioned you don't necessarily name it that, but when you're working with someone, how do you present that? Or how do you encourage that exploration to help them find some peace around the spectrum of life and that we will all die at some point?
Yeah. It's really different. It depends on what people gravitate towards, you know?
Mhm.
So, yeah, some people just, I feel like I work the best and most deeply with people who are just gravitate towards some sort of spiritual practice or spiritual orientation naturally,
Yeah.
even if they've been very abused and had a lot of difficulty and damage done by other people. But if there's a sense, like I have one patient that every time she gets into like feeling confused or not knowing what to do, all we have to talk about is the golden river or the aloha spirit, and either of those phrases really helps her connect in with her own life force and
Mhm.
her own spiritual nature. And then it's almost like a little chiropractic maneuver to
Like
alignment.
realignment. Yeah.
Yeah, yeah. And
I love
so,
that.
but I think it's different for every
Yep.
person. And I'm always curious about what's going to be the through line, what's going to bring someone into their own sense of, oh, yeah, my wholeness. Oh, yeah, my eternal nature. Yeah, yeah,
Yeah.
that.
Yeah. Yeah. In some ways, we're lucky that there are a lot of paths towards that, right?
Mhm.
So that you can find what resonates with you most. But I
Yeah,
think just to reflect back on to summarize some of the main points you said, really the spirituality, this connection to wholeness, the spiritual connection is the foundation that having some kind of practice there is going to help hold the rest as you start digging deeper into things. And then I love your idea, what you said too around just maybe you can I'm probably forgetting the exact phrasing about like just the accurate timeline, like or not, maybe you didn't say that. What did you say? about like recalling the
Yeah, accurate narrative.
narrative. Thank you. Accurate narrative. And then the various practices we can bring in to just for like life force and to help move energy.
And then I have quite a few patients that we do like meditations on YouTube together during our sessions, like finding the one practice that really helps them release difficult energies, stuck energies, and come into a sense of coherence and regulation,
Mhm.
often rest. So we find the practices that are the most useful for people. And quite a few of them are grief practices, because I think
Mhm.
that is actually that's a life skill that we are not taught, that is absolutely just foundational for getting through life, especially
Yeah.
as we get older and have medical issues. If we don't know how to grieve, can't grieve, or are going to let's just bury it and move on state, then we tend to lose our humanity in
Mhm.
certain ways. And yeah, it's just very difficult to make it through life in a way that's open and available if we haven't learned how to do grief work.
Yeah, I agree. We so easily, well, I shouldn't say so easily. Maybe that's not true for everybody,
Yeah.
but more easily learn to love. But like with love comes grief. That's like the other side of the coin, right? Is whether that's just the loss of an important relationship, a death of somebody, or just a transition into something new and different, and the rest is left behind. It's like love and grief really is we need to be prepared for both, right?
Okay. They absolutely come together. Like one of my spiritual teachers, Adya Shanti, says, all true love sheds a tear. That's just how it's baked in. It is
Yeah.
baked in. And so if we can shed our tears in a way that's healthy, and that
Mhm.
shed our tears with all those who are left behind, that it's
Mhm.
the human journey to do
Yeah.
that.
Yeah.
um
That's such a good reminder.
yeah,
I know a lot of different resources out there that can help
yeah,
people in this realm.
yeah,
Obviously, we will share Tracy's, like how to connect with her in our show notes. So if you want to explore some
yeah,
of this more one-on-one work with her, you definitely can. But do you also just have some favorite resources? Like you mentioned YouTube to find meditations, or
yeah.
what are some resources we can share?
Yeah, I love YouTube. Yoga practices on YouTube, qigong practices on YouTube, meditations on YouTube.
Yeah.
There's so much out there. I don't really want AI in my life.
Mhm.
I just feel it doesn't have a chakra system, and it doesn't have auras, and it doesn't have it's putting together the pieces that have already been put out there. And so I don't really particularly myself want that. I want real live humans with chakra systems and with
Yeah.
auras, with a heart.
Right. Right. That's a good
Dating
reminder too. Yeah.
my own personal preference. But yeah, I think there's so many people out there that are just wonderful healers. And I think really just following your own sense of where you're led is the most important thing, and following your own intuition about who might be helpful for you during what stretch of your journey.
Mm. Okay.
The most important thing. And also asking around friends and family, like who helped them. Yeah.
Yeah. Do you have any favorite books or authors on the subject?
I always loved Rachel Naomi Remen's books, Kitchen Table Wisdom and My Grandfather's Blessing.
Mhm.
Just really saturated with love, those books. Yeah. Lissa Rankin has some good books on like the sacred medicine book that she wrote. I think she and her partner also have a book coming out that's on called Relation Sick, that's on the
Mm.
physiological toll that is taken by narcissistic abuse. Yeah, just there's really a lot out
Yeah, there are.
there, a lot of good. Yeah.
That's a good starting point.
Yeah.
That gives people a good place to start. And then you can go into the whole full world of support in that realm. Yeah.
Oh, yeah.
Tracy, before we wrap up, is there anything else you'd like to add or anything we didn't cover that you feel would be important to share? Anything else that's on your heart?
I think there's so much going on in the collective these days, and I think so much anger that is there. It comes from a clarity and an outrage that makes sense. But I think, like grief, it's also we need to learn how to compost that anger instead of aiming it at other people or the earth or organisms or your dog. And
Hmm.
so there's something about composting our anger down into the earth that's actually very important as a life skill. And then what you're left with is clarity, which that's the useful part of that, is clarity and action.
Yeah.
So trying to make sure the anger stays constructive.
Yeah. That we don't keep it inside.
Yeah.
We don't suppress it, but we mutate it into
Yeah.
a form that's not
Adjust it.
destructive.
Yeah.
Yeah.
We compost it. We
Yeah.
make sure that it gets, yeah.
That's
Mhm.
great. I think that is a very appropriate place to end our conversation. Tracy, thank you again so much for being
Oh,
here. I'm sure people received a lot of useful insights. And like I said in the show notes, you'll find more information about how to connect with Tracy, plus some of those resources that she shared if you'd like to dive deeper into this work, which I would suggest that you do. I do think it is a very important piece to the healing puzzle. And I, time and again, and before this really became front and center for me, as an integrative practitioner, I knew that sort of surface level, this was important, but I was like in the world of food and nutrition, and that was where my brain was until eventually it just hit me that I kept getting clients to a certain place in their healing journey and we would hit a wall and we couldn't
mhm.
get past that wall.
Yeah.
And then it finally dawned on me that, oh, there's like this whole energetic field that's like blocking the
Yeah.
rest. And
Yeah.
from emotions, from stress, from all these different things. And so then it was like, okay, actually, this is probably the most important place to start to
Yeah.
really open up the energetic field. So then all the other things we bring in have more
Yeah.
impact,
Yes.
right? They
Yeah.
do deeper
Yeah.
work.
Yeah, they do. And you are always a natural, I think, in terms of warmth and caring and sort of emotional support for
Mm.
patients. You're always just very natural at that. And so I think you actually did quite a bit of
Without
support.
realizing it.
Yeah, quite a bit of supportive psychotherapeutic work without realizing it. Yeah, exactly. Yeah.
Yeah. Well,
And
but now I'm saying now it's like an actual stance that it is very important, everybody. And we want to make this an intentional piece of your healing plan. So I hope that resonates with you. All right, everyone, thank you so much for listening. Please remember to share this with others who could benefit from what you're learning here. And I will look forward to seeing you again on next week's episode. Bye for now.